Hey guys, I did my paper on a case I did a few weeks ago where a lady came in. She was 46 years old and went into the ER a week before for stomach pain, and they did a CT scan on her and found that one kidney was smaller than the other. So the name of my paper was Renal Atrophy Without Disease, because we did a renal duplex on her and found that even though her left kidney was smaller than the right one, there actually wasn't anything wrong with it. It was just small. So, and you can tell this was her right kidney, which is the pretty one. It's got the pretty capsule around it, and it averaged about 11.5 centimeters. And the left one was shrunken down. It really didn't have a capsule around it like this one does, and it averaged at about 7.5. So there's about a 4 to 5 centimeter difference, and typically we only want it to be about no more than 2. Kidney normal for renal duplexes, kidney measuring 9 to 12 centimeters with no more than 2 centimeter difference. With a well-established capsule like this one, low resistant waveform, which the left kidney did. It didn't have any high resistance, showing in kind of stenosis that would be causing problems with the blood flow to it. Ratio less than 3.5 to 1, which it was, and a renal index less than 0.7. If anyone's not sure what the equation is, I did find it in one of our textbooks. It's right here. The PSV minus the end diastolic velocity over the PSV. The velocities between the two, the right was a little bit higher than the left. The velocities to the left one were kind of small, kind of low flow, but there was no stenosis or nothing, no blockages that were causing an issue. Another interesting thing we noticed was that her right one had a dual artery coming off the aorta, which kind of shows to us that her body has been compensating for the smaller one all along. So it was probably a birth defect that she's had forever, and no one ever noticed it until she went and had the CT scan done. She didn't have any risk factors. Risk factors include smoking, hypertension, hyperlipidemia, diabetes, cardiovascular disease, all the same risk factors we see for any arterial issue, and she didn't have any of them. She was only 46, so she really wasn't even that old, and age can be a risk factor too. And she didn't have lupus or no family history of kidney issues that she knew of. So it was a really interesting case to see that her kidney was small and there was nothing wrong with it. So I thought it was cool and did my paper on it. Thanks, guys.